Welcome to The Simple Show, a talk here with Dr. Heinz Lüschel. Today's topic is diagnosis, psychosomatic illness. So let's start off. Can you explain very simply and briefly what is, the definition psychosomatic? What does that mean?
As the word says, the psyche affects the body. That's normal. When you're nervous, when you go to the dentist, you might be so nervous you get the diarrhea. See, that's psychosomatic.
Okay.
Very common and normal.
Now, can it also be like serious, things, serious issues, or is it just, okay, you have diarrhea, if you're anxious?
That's a simple symptom, but it can be more serious, like a chronic headache, or even that you get a heartache. This can be psychosomatic. It has to be checked to find out if is it real or is it just
psychosomatic.
As we say, psychosomatic. So it's very important to check the patient, do all the exams necessary. We have really to exclude any organic cause for these symptoms.
Okay. Is it something that is thrown around pretty quickly if, school medicine just doesn't know and can't find anything? If you can't find anything, you don't have a solution, you just say, it's psychosomatic.
Yeah, that's the case. Yeah. When we do everything, we checked out what's possible, and we don't find a cause. So what other explanation do we have? Then we call this a psychosomatic symptom.
Okay.
But I'm not always sure.
Okay. So let's go into a real conversation here. So I had a call sometime this month, and this is a person mid-20s with intense headaches, and these mornings, evenings, very, very intense headaches. Can't sleep, obviously, so that turns into being very tired, exhaustion, and he's, checked everything. The MRTs, the CTs, even like the sleep laboratory where they check how you sleep, everything was done. And he continually kept on going to the hospital, but they couldn't find anything, multiple MRTs. And now the diagnosis, it's just a psychosomatic illness. Now, let's say this patient comes to your practice. What do you do in this case?
In our medicine, we have a few more possibilities for checkups.
So let's start. What do you do in your integrative medical practice?
In this case, I would do more lab tests. So what I would check is micronutrients. A lot of them we can measure in the blood. So I would measure all the minerals, the trace minerals, the amino acids, the fatty acids, vitamins we can measure, even antioxidants. It's really helpful to know more about the biology of this body. This is step number one I would do.
Okay, but hold on. So, I'm talking about severe headaches, and maybe just lacking some trace minerals could be it? Well, that sounds a little very simple,
That's right. And in this case, I wouldn't expect a solution just by doing these lab tests. So in this case, I would also measure a lot of hormones. My experience is that lack of testosterone or progesterone, this is the pregnancy hormone, but why do men have progesterone?
Is this for the brain?
Yeah, absolutely important that the brain is in need of enough progesterone. And this is something I would check when these two hormones are low in a man, then he is suffering psychologically.
Which could result in headaches.
Yeah. Okay. So that's a door I would step in, and besides the other lab tests, and then the last step what we can offer is measure the mitochondria function. A patient that is extremely exhausted is lacking energy, so we have to consider the cells. every cell of our body contains about 2,000 or more mitochondria, a brain cell up to 10,000. So when these mitochondria are damaged or not properly working, the energy is so low and you can't find anything. You can do CTs and MRTs as many as you want. You don't see anything. This is happening in the cells. This is microscopically small.
And then how could you help with mitochondria? IHHT, for example, would be maybe something.
Exactly. I would offer such a patient 20 sessions of IHHT, but also a lot of micronutrients.
Would you just go back to your diagnosis of step 1 and just supplement the ones lacking? If you see that your the cells don't have enough energy, or would you just kind of fill up everything?
Of course, if something is lacking, that's more important to replace, of course. But in these cases, it's not wrong to give more than the minimum. See? Offer more of all the vitamins and minerals and amino acids. See? It's because the body, it's better to have too much than too little.
Okay.
But this case you were describing is really something severe. This case, I don't think it's psychosomatic, but we have to admit that there are a lot of people suffering just from psychosomatic illnesses, which are not nothing severe. But for the patients, of course, it's it's not comfortable.
Yeah, and it's a hopelessness, If you go to your doctors and you have all these modern instruments checking your brains, doing all these scans, and the result is nothing, there is no problem.
Yeah.
You do seem very hopeless. So I think, giving hope is also a part of
that's very
therapy.
important. See, especially in cases of tiredness, when you cannot work 100%. Let's say after lunchtime you're exhausted and you have to go home. I mean, this is severe. See, you might lose your job, you might lose your relations, and so on. This is severe conditions, and then these people start suffering mentally, and as soon as this process begins, the symptoms, the organic symptoms. Grow more severe.
And maybe the last question, what is the duration of a therapy like this?
Oh, this is it varies a lot. So if you're very lucky, it's a few weeks. And if there is bad luck, it might go for months. See, the most severe cases we have in long COVID symptoms, they suffer over a year. But to give up is no option for me, and this is what I tell the patients. See, never give up. There is always hope.
Okay, thank you for letting us take a little look into what you do at Wise Medicine. Thanks for watching. That was a simple show. See ya.